Welcome to the Better2Know Instant Test training video series developed in partnership with the Center of Excellence for Sexual Health. This video will focus on an individual instant test in a number of sections, from what is included in the kit to using it to test for infection, interpreting the results, and completing the test process. You can also find the information included in this video in one of our quick reference guides, which should be provided to you along with your first delivery of our instant test kits. Our aim in presenting this video is to provide you with all the information you need in order to successfully run and deliver one of our instant tests. There are a number of safety procedures to be followed in order to ensure the test can be carried out. These include storing the kit safely within a temperature of 2 to 30 degrees Celsius, not using the kit if it is not sealed, has been punctured, or has been tampered with, preparing a clean and clear area on which to run the tests, wearing suitable examination gloves and clothing, disposing of all materials in a suitable biohazard waste container, and treating all biological samples as potentially infectious. The Better2Know Instant Herpes Simplex Type 1 and 2 test kits include the contents to deliver 10 or 30 individual tests. The contents include a diagram and instructions printed on the inside of the lid, detailed instructions for use, 10 or 30 test cassettes in individual foil pouches, 1 vial of buffer, a pouch of 10 or 30 lancets, 10 or 30 alcohol wipes, 10 or 30 adhesive dressings, and 10 or 30 sample collection tubes specifically for the Herpes Simplex Type 1 and 2 tests. The pipettes provided have a line drawn on the end of the pipette indicating the point up to which to draw the blood sample. The blood sample may be collected using either the plastic sample collection tubes provided in the kit or by using one of the EDTA glass capillary tubes provided along with the other Better2Know instant tests. Instruct the patient to wash their hands in warm, soapy water. Then sit them down and choose the middle or ring finger on their non-dominant hand to provide the sample. Clean the selected fingertip with an alcohol wipe and allow it to air dry. Place the lancet off-center on the fingertip. Press the lancet firmly against the finger and puncture the skin. Wipe away the first drop of blood with a cotton ball. Use a capillary tube to collect the blood sample. Fill the tube by holding it horizontally against the puncture, drawing the blood out by gently squeezing the finger. Try to avoid letting any air bubbles form inside the tube. Alternatively, the patient can directly drop the sample into the well of the test cassette. Remove the test cassette from its pouch and place flat onto a clean and clear surface. Please add 1 drop of blood to the sample well of the cassette. Then add 2 drops of Herpes Simplex buffer. Read the results 10 minutes after the addition of the sample. Do not interpret the results after 15 minutes. To read the test results, a control line should appear in the area marked with a C on the cassette. This indicates the test has run successfully and should appear in the event of either a reactive or non-reactive test. If the control line does not appear, the test has not been successful. In this event, the test should be repeated using a new cassette and sample. The instant tests for both Herpes Simplex Type 1 and Herpes Simplex Type 2 test for both the IgG and IgM antibodies. If there is a positive finding of either, the lines will appear as separate lines on the same test window. A reactive IgM result will be present with 2 lines. One will be the control line, marked alongside the C, with the other being the IgM alongside the M marked on the cassette. A reactive IgG result will again be present with two lines. One will be the control line, with the other being the IgG alongside the letter G on the cassette. An IgM and IgG reactive result will be present with all three lines. The control line, a line at the position marked M, and a line at the position marked G. Any visible line, areas marked M or G, should be interpreted as a positive result. A non-reactive result will be present with only the control line being visible on the test cassette. Results must then be told to the patient. This should be done verbally in a calm and prompt manner. The patient should be reminded that they may contact Better2Know if they need any further assistance. The Better2Know Instant Test Results Report, which is attached to the patient's booking confirmation email, should be completed. A copy should be handed to the patient. In the event of a positive Herpes Simplex Type 1 or Herpes Simplex Type 2 test result, please counsel the patient on appropriate management of their condition. If you feel treatment is indicated, please discuss those options with the patient. The instant test procedure has then been delivered. This video has provided you with the information you need in order to successfully deliver one of our instant tests. In the case of any further questions, please contact Better2Know using the details on screen. Thank you for taking the time to watch our instant test training video.